Hi, I'm Terry McMinn, the Cancer Care Coordinator at Lewistown Hospital, and also a speaker for the Pennsylvania Cancer Education Network. We will be bringing you 4 programs on cancer education. Today's program will be on ovarian cancer. Ovarian cancer education. So what is ovarian cancer? It's actually when the certain cells in the ovaries grow out of control. As the tumor continues to grow, it may spread to other parts of the body. Today we're going to be discussing the ovaries. The possibility of our ovaries on either the right or the left being affected, and its effect on the fallopian tubes, uterus, the cervix, and the vagina, as you can see proportionally here on the map. So how common is ovarian cancer? We're looking at 2005 statistics in the state of Pennsylvania. It occurred 1 out of 57 women and is the 4th leading cause of all cancer deaths. So you can see that it is not that common. However, the death rate of 4th leading cause of all cancer deaths among women is very significant, and why it's important for us to learn about this cancer. Are you at risk for ovarian cancer? You are if you have a family history of cancer, if you have a mother, daughter, or sister with ovarian cancer, or if they have breast, uterine, colon, or rectal cancer. The reason is we know that there are some familial syndromes in which those cancers among first-degree relatives, such as mother, daughter, or second-degree, such as grandparents or aunts or uncles, that there are syndromes in which might put you at a greater risk for ovarian cancer. If you yourself have a personal history of cancer, if you have breast, uterine, colon, or rectal cancer, you would be at higher risk for ovarian cancer. Other risk factors include age over 55, never having been pregnant, and use of menopausal hormone therapy for prolonged periods of time. Women with lower risk have used oral contraceptives such as birth control, and we're not sure the significance of that or for how long. Also, if you've had at least 1 child, if you've breastfed, if you've had a tubal ligation, if you've had a hysterectomy with the ovaries removed, then you've actually removed the organs. If you've followed a general healthy lifestyle habit, including a healthy diet, regular exercise, and plenty of rest. So what are the symptoms of ovarian cancer? Even early stage ovarian cancer may have the following symptoms: bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, and possibly urinary symptoms such as urgency or frequency. Now, these symptoms may individually or by themselves indicate something such as just a routine time of month for a woman with her menses. However, if it is something in which the bloating is ongoing and persistent, or the pelvic pain is ongoing and persistent, and there doesn't seem to be a cause, you're not sick, and it isn't that time of month for you, those are things that you really need to discuss with your physician, and don't let it go on for months and months. Things such as difficulty eating or feeling full quickly, if something such as that persists, that's something that you really need to see your physician about. And also urinary symptoms. That could be something to do with the bladder, but could also be from possibly ovarian cancer. What can I do if I'm at risk for ovarian cancer? Really discuss your factors, your risk factors, with your healthcare provider. If you have any of the symptoms and they persist and they're unexplained, contact your healthcare provider promptly and see a healthcare provider on a regular basis for a pelvic exam. 3 basic questions that you might want to ask your healthcare provider is, what is my main problem, or what's my risk? What do I need to do to perhaps lower that risk? And why is it important for me to follow what you're advising? What are the tests for ovarian cancer? This particular cancer is one in which there is not a perfect screening test. So screening tests are not recommended for everyone. So there's no one blanket screening for ovarian cancer. And this is what makes it difficult to get women to be aware of this cancer. After you and your doctor discuss your risk, screening tests might be recommended. And the three that would be recommended would be the pelvic and rectal exam, the transvaginal ultrasound, and the blood test for the antigen CA-125. Now, for many people who followed the news in probably the past year or two, the blood test for the CA-125 many times has been touted as a screening test, and this has really been improperly projected by the press. It is a blood test that can be helpful in detecting ovarian cancer, but the blood test by itself does not screen specifically for ovarian cancer. There are some false positives and some false negatives for other conditions going on. So physicians, with the research they have done, have not felt that that test can stand alone as a screening exam. What are the types of treatment for ovarian cancer? The following are the most common treatment options. Surgery is always the gold standard. The goal will be to remove the ovaries, and with this surgery, at the time it's done, the uterus is always usually included in that so that they're able to look at the cells under the microscope to determine how much the extent of disease includes. Chemotherapy may be indicated if the ovarian cancer has spread outside the ovaries into the pelvis. Radiation therapy is rarely used anymore. It's usually surgery followed by chemotherapy, but is dependent upon each individual case. Early detection increases your chances of survival. You can get additional information from the Pennsylvania Department of Health at the website, the www.pacancereducationnetwork.com, and also from the National Cancer Institute's number, the 1-800-4-CANCER. Pennsylvania Cancer Education Network is a program in which the grant has been provided to 4 institutions to deliver the program throughout the 67 counties in the state of Pennsylvania. The network includes the Pennsylvania Cancer Education Network, which is funded by the Pennsylvania Department of Health through a grant the department receives from the Centers for Disease Control and Prevention. Ovarian cancer age-adjusted incident rate. This particular map represents the year 2003 to 2005. For all females diagnosed with ovarian cancer in the state of Pennsylvania, the rate was 13.7 individuals. This next map is the age-adjusted mortality rate, looking at deaths from ovarian cancer. The years here are 2004 to 2006. And it's looking at the state of Pennsylvania with an average death rate of 9.3 individuals.